Welcome to the podcast. I'm Jess, a family nurse practitioner and legal nurse consultant, and this is the space where healthcare, law, and real-life situations intersect. Each episode is designed to break down complex medical and legal topics in a way that's clear, accurate, and grounded in evidence, without fear, misinformation, or sensationalism. Whether you're a healthcare professional, attorney, gig worker, parent, or simply someone who wants better how medical events and legal responsibility overlap, you're in the right place. Let's get started. Hook, a short real-world example. Picture this. An older woman discharged from the hospital after pneumonia gets home and takes her usual heart medication the same day she starts a new antibiotic, which interacts and causes dangerously low blood pressure. She calls her daughter, who notices she's dizzy and slumped. They go back to the ED. The bright spot, the discharge summary had the right plan, but no one had confirmed the medication changes with the patient or the pharmacy. One simple action, a clear written medication list handed to the patient and confirmed with the pharmacist, could have stopped this. Promise. In this episode, I'll walk you through a nurse-led, step-by-step safety checklist you can use before, during, and after any medical visit. By the end, you'll have 3 ready-to-use takeaways you can keep on your phone or fridge: a pre-visit kit, a 3-question script to use in the room, and a transition checklist to avoid medication and communication errors. Section 1. What common preventable errors look like and how to prepare. Let's start with the kinds of mistakes that show up again and again. First, medication errors. That's giving the wrong dose, continuing a medicine that should have stopped, or missing an interaction. Second, communication breakdowns, when teams or family members don't share the same information. Third, diagnostic delays, symptoms dismissed or tests not followed up. Fourth, documentation slips, notes that don't travel with the patient or that contain outdated medication lists. These aren't mysteries, they're process problems we can reduce with simple habits. Now, the pre-visit prep checklist, what to bring and how to be ready. Number 1. An up-to-date medication list that includes prescription drugs, over-the-counter meds, vitamins, and supplements. Include dosages and the time you take them. Number 2, photos. Take a clear photo of any skin changes, rashes, wounds, or injury sites before you go. Number 3, copies of recent test results, discharge summaries, or specialist notes. A single folder or a phone folder works. Number 4, bring a short written list of your main questions. Prioritize the top 3. Number 5, bring someone with you if you can. A second set of ears is invaluable, especially for older adults and kids. And lastly, if language or cognitive barriers exist, request an interpreter or patient advocate ahead of time, so you're not relying on ad hoc explanations. Tip for parents and caregivers, practice explaining the child or older adult's baseline function and what's changed in one sentence. Clinicians are juggling many patients. A short, clear description saves time and reduces misdiagnosis. Section 2. What to do during the encounter and how to handle treatments and medications. First and simplest, verify identity. If a nurse or tech asks your name and birth date, answer loud enough and steady. Don't assume a room or wristband is enough. Ask the team to confirm the reason for the visit in plain language. Can you tell me what problem you're treating today? If the answer is vague, ask for clarification. Second, use teach back. Say aloud what you heard the clinician say and ask them to confirm. For example, so the diagnosis is X and the plan is Y. Is that right? Those 2 sentences force agreement. Medication safety on the spot. When a medication is ordered or changed, ask 4 quick things: the name, the dose, how often, and the reason. If it's a new drug, ask about common side effects and interactions with what you already take. If you can, watch medication preparation, even in the hospital, and confirm the label before it's given. If someone says this is your usual dose, don't assume. Check the list you brought. Discharge day is a high-risk moment. Before you leave, insist on a written discharge plan that includes the diagnosis, a medication list with what to stop and start, clear wound care or activity instructions, and a specific follow-up appointment date or time frame. Ask, who do I call if X happens, and get a phone number. If there are medication changes, ask the nurse to reconcile your home list with the discharge list and sign off on it with you. If pharmacy delivery or insurance coverage might delay your meds, arrange that before you walk out the door. Section 3. Handoffs, follow-up, and when to escalate. Handoffs, moving from ambulance to ED to ward, or hospital to rehab, are where information falls through the cracks. Ask for the written transfer summary and read the medication list aloud when possible. Document any concerns in writing and ask for the issue to be noted in the chart. If you notice a missing allergy or medication, say it immediately and ask the team to correct the electronic record. When to escalate? Call a clinician or patient advocate if you encounter one of these red flags. No plan for follow-up, confusion about who's responsible for a medication change, worsening symptoms without a plan, or repeated conflicting information from staff. Many hospitals and clinics have a patient advocate or ombuds office. Use them early if communication is failing. If you're at home and symptoms are serious, chest pain, severe shortness of breath, sudden weakness, high fever, call emergency services immediately. Recap and takeaways. Let's boil this down into 3 ready-to-use items you can save on your phone or print and stick to the fridge. Takeaway 1. The pre-visit kit. Carry a current medication list, photos of problems, recent test results, and your top 3 questions. Takeaway 2. The 3-question check and room. Ask, what is my diagnosis? What is the plan? What medications or side effects should I expect? Use TeachBack to confirm. Takeaway 3. The transition checklist. Before discharge or transfer, get a written plan, a reconciled medication list, a follow-up appointment, and a contact number for questions or worsening symptoms. A few final practical tips. Keep one central place for your medical information, a labeled folder or a secure notes app. Photographs of medication bottles, insurance cards, and recent test summaries can be lifesavers. If you feel overwhelmed, bring an advocate, a friend, family member, or professional patient advocate to help you hold the line on safety. These small steps don't need medical training. They just need consistency. If this episode helped you, subscribe so you don't miss future nurse-led episodes that separate medical fact from fiction. Share this checklist with a friend or caregiver who might benefit. These tips multiply when they're shared. Thank you for listening. If today's episode helped clarify a medical or legal issue, or made you think differently about how emergencies and accountability intersect, that's exactly why this podcast exists. I'm Jess, a family nurse practitioner and legal nurse consultant, and I work with attorneys, organizations, and professionals who need clear medical insight in complex cases. You can learn more or schedule a consultation at faqbynursejessconsulting.com. If you found this episode valuable, please share it, subscribe, and leave a review. It helps this education reach the people who need it most. Until next time, stay informed, stay compassionate, and always put safety first.